Dr. Janet Woodyard. I'm a board-certified plastic surgeon. I've been in practice in the Owings Mills area for 30 years. I do everything from head to toe, all types of plastic and reconstructive surgery, particularly cosmetic surgery, and we do a large amount of non-surgical facial rejuvenation with fillers and neuromodulators. Okay, I'm frequently asked from patients, what's the difference between a neuromodulator or a neurotoxin and a filler? They work hand in hand, but they are very different types of products. Fillers are exactly what they say. They fill, so they add volume, they fill in lines. Neuromodulators or neurotoxins relax muscles to get rid of lines. So for dynamic wrinkles, the 11 lines, crow's feet, lines along the jaw, we use neuromodulators. So neuromodulators will relax muscles, and we can actually cause muscles not to move at all. So people can't frown and make these lines. Neuromodulators can soften lines around the mouth and actually lift the lip. Neuromodulators will last traditionally only 3 to 4 months, but we are so happy that we are going to get Daxxify. And Daxxify we are bringing on board right now, and this neuromodulator lasts at least twice as long. And everybody's been waiting for this for a long time because most of our other neuromodulators, Botox, Jeuveau, Xeomin, Dysport, we have used them all, will last possibly 3 to 4 months. Daxxify, the median duration is 6 months, and some patients will actually get 9 months. So our patients will need to come in less frequently. So we're very excited about this neuromodulator. We decided to bring the Revance RHA fillers into the practice because they are a more premium filler that are manufactured differently than our standard fillers that we've been using for many years. I find that they give a much more natural result. They are flexible, so facial motion is not impaired by these fillers. My experience has been that there is not that stiff, unnatural look that sometimes you can get with fillers. They are well tolerated, and they last a little bit longer, which is always important. Most patients are good candidates for hyaluronic acid fillers. Hyaluronic acid fillers, which the RHA line that we're happy to be introducing, can be used in all areas of the face. They come in different weights, more robust fillers for volume restoration, softer fillers for wrinkles, and the Redensity, which is for very fine lines. It's a different type of filler that actually rejuvenates the skin and erases fine lines. And there are 4 different levels of the RHA fillers, so it's applicable to all areas of the face. For someone who has nasolabial folds, the intermediaries, the 2 and 3s, work very well. The RHA 2 or 3 can be used in the lips depending upon how much volume a patient wants. We can also just address the fine lines around the mouth. The other areas that we tend to inject frequently, the cheek, because that's where we lose volume. The jawline is another great area for fillers. Occasionally we have patients with sunken temples, and that makes people look very old. So filler can actually be injected in those areas as well. It depends on the face, it depends on the age of the patient, and it depends on the goals of the patient. Even after a facelift, patients still have fine lines around the mouth. So touch-ups with fillers and neuromodulators, frequently with surgical procedures, with thread lifts, with neck lifts. Many times still fillers are needed because we're rejuvenating the whole face. So surgery addresses some issues. Non-surgical means addresses other issues. Skincare also addresses other issues. And for natural facial rejuvenation, which is my major concern, I always want my patients to look very natural. It's a combination of all of those things that gives the best results. The results that you see with a hyaluronic acid filler, such as the RHAs, is immediate. So the results patients see while we're injecting. It's always my custom to inject part of the face, hand the patients a mirror so they can see the difference of what we've accomplished with the filler. Sometimes there's a little bit of bruising and swelling, which can happen, but that doesn't last a long period of time. So results are immediate, and then they last over the period of about a year or so. Okay, we're going to talk a little bit about fillers. Fillers are used to replace volume that is lost with aging. And as we get older, our faces get thinner. And as a result, we develop lines, we develop hollow areas, and we start to get some sagging of the soft tissues. So fillers, in my practice, I always start from the top and work down. We inject a more robust filler in the cheek area, which we did on Stacy with the RH4. And as we move down the face, we sometimes go to a little bit of a softer filler where there's more motion. So we also used a little RH4 down to replace volume in her chin area, because women, as we age, lose not only soft tissues, but we lose bone mass in our mandible. So adding along the jawline is very important to have a more youthful face. And then we did a little bit of RH3 in her nasolabial folds, and a little bit of RH3 along the chin area as well. These new fillers we are so happy to be introducing to our practice. The Revance RHA fillers are a premium type of hyaluronic acid filler, a little bit different than our traditional other fillers that we've used for many years. These fillers are manufactured in a more natural way. There's less cross-linking. So as a result, they tend to be more flexible, more natural in appearance, and also last a little bit longer, which is always a plus. So Stacy, tell us about your experience with the RHA collection.
Best experience I've ever had as far as being injected with fillers. Could not feel anything. Very easy, quick, no bruising, no swelling, and I had instant results, which I was super happy about.
And Stacy has had just about every filler and every procedure that we do. She's been with me for a long time, so she is an expert in this area. Thank you for joining us for our live event for RHA.
Don't forget to look out for the text at the end of our event. Make sure to click yes for your complimentary consult with Dr. Woodyard and 20% off your treatment that day.
I'm not hearing any questions. Hi, everybody. It's Dr. Woodyard. I hope you enjoyed our event. I'm here to answer any questions you may have. I don't see any yet on our screen, but we are introducing the RHA, as you saw. We're very excited about it. So if you click on the text that you'll receive at the end of this event. We can get you scheduled for an appointment. We are also giving away a free syringe and 20% off our patients who participate in this event. I do have a question about how I should prepare for your filler appointment. Most important thing is come with your questions written down if you have specific questions. We'll go over everything just as we normally do. Most of you have been patients here. So we'll go over everything, figure out what's the best treatment for you, and then schedule the injection. If you are a patient that we have seen before, if you've already had hyaluronic acid fillers such as Restylane or Juvederm, or even if you're a Radiesse patient, we can probably just go ahead with the injection that day if we've already injected you in the past. We also have a question, what's the cost? The cost of the RHA fillers is the same as our Restylane cost, which is $750 a syringe. And we usually give a $50 discount for subsequent syringes if patients get more, but we are doing 20% off for the participants of this event. Let's see. And somebody's asking, do I need to wait until Botox is completely gone until I get Daxxify? You don't need to wait till it's completely gone, but you do want to wait till it's starting to wear off so I can see the motion of the muscles, depending upon where we've injected. But it's important to see motion in the muscles so I can inject the appropriate areas and the appropriate dose. But most of our patients don't wait until their neuromodulators are completely worn off. But you want to be starting to see some motor activity so I can just inject the appropriate places. Somebody's asking, can I get treated the same day that I have a consultation? Yes. Yes, if you're a patient of ours, if we know you, if we've already done your injection, or if you're a new patient, we could schedule a consultation and injection the same day. We just need to have the appropriate time scheduled. If you're coming in for injection, remember, don't wear any makeup. Preferably wash with an antibacterial soap before you come into the office. Don't take things that can cause more bruising, such as aspirin. Stay off of aspirin for about 10 days. If you do take Motrin, Aleve, Advil, things like that, try not to take them for a week. Omega fish oils, the same thing. High dose vitamin E. All the usual things that we tell you not to take before surgery. It's best not to take before fillers so you have less bruising. We do have an instruction sheet, so if you are a new patient and have never had fillers and don't have our instruction sheets, we can always send that to you beforehand. All right, let's see. Let me see, I'm scrolling down. I'm just clicking some things here on the screen. Can I get RHA and Daxxify the same day? Oh, yes. We can definitely do fillers and neuromodulators the same day. Just, be prepared and have enough time. But yeah, we frequently do those the same day. You will not do a skin peel the same day if we're doing fillers and neuromodulators. If we're going to do Daxxify and you're coming in to see Stacy, say for a peel, you can get your peel done and we can also do the Daxxify the same day. But we usually don't mix the peels and fillers on the same day. But we can definitely do fillers and definitely do the Daxxify on the same day. I have another question. What is the best age group this would work for? I presume that question is regarding the fillers. Fillers can work on any age depending upon what your goal. So for younger patients, mostly for fullness of the lips, a lot of lip augmentation patients tend to be younger and just want more fullness in the lips. If there's a particular contour of the face that patients want more fullness, possibly in the chin, along the jawline, or if someone's flat in the cheek and they want to add a little roundness, that can be a younger patient. As we age, though, then we're addressing more lines, loss of volume, and fillers I have patients into their 80s that get fillers, as long as someone's healthy enough and that we can correct the problem with the fillers. Sometimes surgery is a much better option, and those are the kind of things that we talk about in our consultations. But fillers can range for all ages if it's being given for the right reason. Next one, I think I answered that. How should I prepare for a new filler? We answered that one. Can I work out after injections? Not the same day. Preferably, if you're getting fillers, you don't want to exercise right afterwards or have a lot of perspiration. It can increase the bruising, and you don't want to be in a gym where there's more bacteria and things like that. After Daxxify, you don't want to exercise. After all neuromodulators, you want to stay in an upright position for at least 4 hours. So you're not going to lay down like on a press, bench or things like that. So you do want to stay upright. So it's best not to exercise the day of the injections, but the next day, you can do everything as you normally would. Let's scroll down and see if there's any more questions, or scroll up and see if there's any that I missed. How long should I wait for makeup after injections? If somebody's coming in and having fillers, I prefer that they wait till the next day just for the injection sites to close up before you put makeup on, because you don't want to introduce bacteria and potentially develop an infection, which is extraordinarily rare, but it's best not to put makeup on that day. Botox, there's really no need to put makeup in those areas the same day. But Botox are smaller injections. If you were leaving here and going to work and wanted to put makeup on, that's usually fine. But for fillers, I recommend patients leave their makeup off until at least a few hours afterwards, but preferably the next day. All right. Let's see if there's any other questions. Is RHA a good option for men? That's a good question. How about Daxxify? Also a good question. We do inject fillers and use neuromodulators like Daxxify on men, not as frequently as on women. Maybe 5 to 10% of most practices are male, but for the same reasons. If there's deep lines that are muscle related, like frowning, crow's feet, that's what Daxxify is good for. Lines across the forehead, also good for Daxxify to soften the muscles. If there are areas where a male patient wants more volume, not uncommonly along the jaw is a good area for fillers. The RHA 4 would be good for something like that. And occasionally to soften lines, but on a male face, we're much more conservative. We don't want to round the face too much. We don't want to feminize the face too much. But occasionally men will do their nasolabial folds. Some men will come in for a little extra volume in the cheek, but more frequently along the jawline is where men sometimes want some additional volume. But definitely the Daxxify to get rid of frown lines, crow's feet, works just as well on men as it does on women. Sometimes they need a higher dose though, because their muscles tend to be a little bit larger, a little bit more powerful. So sometimes they do need a higher dose than the average female patient. And I definitely want to remind you to respond to the text after this event so we can see you in the office. We are going to have the raffle for a free syringe, and we are offering 20% off. So I'm looking forward to seeing you all. We're very excited about this new product, getting beautiful results with it, and very excited about Daxxify. That's going to last about twice as long as our other neuromodulators. So thank you all for coming. I'm happy that you joined us. I look forward to seeing you. Good night. Bye-bye.